So I'm going to hand it over to the Heartlands Medical Education team to start their presentation. Heartlands.
Hi everyone, welcome to our webinar today. I'm just going to share my screen. We can present using Slido. So thank you for, has it shared properly? Yeah, can everyone hear us? Yes. We're going to talk to you about AI in medical education, and thank you for ASME for inviting us to do the Essentials webinar today. This is just a brief slide to say that some of your data may be used as part of our analysis. If you would like to opt out, please email us at hgsmeded@gmail.com or the ASME events team. So we do want some audience participation. So if you could take a photo of this slide. And once everyone, so I'll give you a few seconds to do that, and then I'll move on. Okay, lovely. So this is our team. So I'm Rochelle, nice to meet you. So I'm a medical registrar and intensive care registrar. I'm currently a CTF at Heartlands.
Hi, I'm Siddharth. I am currently a teaching fellow and I'm an SHO.
My name's Safa Hiali. I'm also a clinical teaching fellow and I'm due to be starting GP training in August.
Hi everyone, my name is Lamia Sabha. I'm a clinical teaching fellow as well.
Hi, and I'm Dan Langley. I'm also a teaching fellow at Heartlands.
And Nick Greaves will be just narrating the video, which is part of the presentation as well. So I'll just switch off our video and carry on with our presentation. So the structure of the workshop, so we're going to cover three themes today. The first theme will be our experience of AI in MedEd, and also exploring your experience. Then going over chatbot as an OSCE station and how we used it as a mock OSCE station for our third year medical students. We're not going to cover the work that we did with our fifth year medical students as well today, but we can talk about it during questions. Then the final stage will be just to talk about theme 3, which is future use of chatbot and AI in MedEd. So as CTFs, I guess our main requirements were to think about whether, evaluate whether chatbot is familiar to medical students with a good user interface. We wanted to do something that was easy for us to access because we're not computer coders, or we don't actually build chatbots ourselves. So we wanted something that we could use as CTFs fairly easily with our third year medical students from the get-go. And the third part of the van der Vleuten equation that we thought was important was that we wanted it to be accessible. We wanted it to be a platform ready for use. So I'm going to hand over to Lamia, and she's going to take you through our OSCE stations.
Hello everyone. So right now I'll be covering how we did our OSCE station when it comes to the chatbot. So this is just a link to the Geeky Medics OSCE station page, where you can find a huge range of OSCE stations, most of which are hidden behind a paywall, but the ones that we chose for our third year medical students were diarrhea and chest pain, depending on the block of students that we were dealing with. So as you see in the diagram, it actually was designed as a typical OSCE station where the candidate would sit outside for 2 minutes reading the prompt that was provided for them. After 2 minutes, they would enter the OSCE station itself. So the format would be in the form of, if you think about it, 8, 2, and 2. 8 minutes to type the questions into the chatbot interface and ask the AI patient, any questions they had about the history, followed by 2 minutes of questions from the examiner relating to the case itself, for example, investigations and management, and then followed by, at the very end, 2 minutes of feedback from the examiner and whether the candidate fulfilled the checklist that is again sourced from Geeky Medics itself. So we collected the feedback from our students in the form of semi-structured interviews in focus groups, as well as surveys in the form of Google Forms. After both lectures and after the mock OSCE stations, this was followed by qualitative analysis using Teget. Here is a video of how the OSCE station worked.
Everyone, my name is Nick. I'm one of the CTFs here at Heartlands Hospital. I'm just going to be running you through the format of the station as it was. So before entering the station, the students have had a brief about the fact that an AI chatbot will be one of the stations. And then when they get to the station, 1 minute to read outside the question that they'll be asked. And then they enter the station.
Hello, could you please tell me your name? Thank you. You can start.
So students want this, once they've entered, have 8 minutes to ask questions of the chatbot, trying to get to a diagnosis. While students were asking questions of the AI chatbot, the examiner's role was to facilitate the use of the chatbot and to mark the history-taking skills using a checklist. After 8 minutes has passed, taking the history, the examiner asked a few brief questions for 2 minutes regarding differentials, investigations, and management.
So based on your history, what is your main diagnosis?
My top differential is Crohn's disease or inflammatory bowel disease.
And how would you like to investigate?
I would like to do some bedside tests such as blood pressure, UZDs, NFTs, and then I'd like to do a colonoscopy, which is gold standard for diagnosis.
Okay, thank you.
After this 2 minutes of questioning, so at a total of 10 minutes within the station is finished, and the examiner led a 2-minute focused feedback session with the student.
So good, you had a good structure of your history taking. Just remember in your differentials to try to distinguish, also remember stool culture whenever you're talking about anything. Otherwise, you did cover all your investigations and mentioned that what the gold standard investigation was.
Okay, so we'll move on to the next slide.
Everyone, my name's Nick. I'm one of
You don't want to hear Nick again.
my name's Nick. I'm one.
Yeah, there we go. So now we'll move on to theme 1 specifically. So the theme 1 is, what is your experience of AI tools and chatbot in medical education? And what do you think as educators? So specifically, these are the same questions that we asked our medical students. What is your past experience of chatbots and AI tool in medical education? What do you think its usefulness was? And now we're just going to ask you the same sort of questions. What we would like you to do is, if you could take a photo, if you don't have if you're using like your phone or your laptop, or you could write it down. So these are the things we'd like you to think about on the next slide. So I can see that some people already responded, which is fantastic. So what I'll do is I'll just start to talk through some of these themes. So I can see that some people have used ChatGPT to help understand content and papers. A few people don't have experience of AI tools yet within the medical education realm, using in teaching preparation. I can see one person has used it as a virtual simulated patient. Lovely. And then I can see that somebody is looking at conversational virtual AI as well, and formative MCQs. So I can see that a lot of you have had a bit of experience of AI tools and chatbots in medical education so far. What we'll do is really address those questions and those themes right at the end of the webinar in more depth, just because of the time limits today. So the next section, I'm just going to cover what the literature says and our literature review so far. So before I even go into that and delve into that, I guess the real question is, what is AI? And the consensus of definitions in medical education is below. So Coppin published this in 2004. AI is a concept. It's a very general, generic term, and it spans so many different processes where machines are acting as intelligence. But this intelligence can be defined, and most often is defined as human-made decisions or learning from mistakes as well. So I think that it's that differential concept. And within that, there's lots and lots of sub-definitions, such as machine learning, traditional machine learning, etc. And within medical education, when AI in med-ed papers mention it, there's different definitions and different papers at the moment. The real pivotal paper that we found was the Scoping Review and the BME Guide by Maurice Gordon and his team. And basically, I think that this slide, I just wanted to illustrate the fact that AI in medical education is very much, and all the literature that's coming out, like there's 278 papers that were included, are mainly based in North America and Europe. And the global South doesn't have as much access perhaps to AI tools in med-ed, but we don't know. This is all speculation. So I think there needs to be further research into why all the research is coming from North America and Europe, and South America as well. In terms of publication, so as you can see, the rise in AI is rapidly accelerating, especially with more open accessibility to ChatGPT and other AI tools out there that are open access and easy to use. So in terms of what the literature says, so only 68 or nearly 70% of studies are primary innovative studies, and the majority of studies are done within clinical sciences. So you can see anesthetics, neurosurgery, a lot in radiology and surgery and dermatology. And that's where the papers and the research are coming through. In terms of AI development and in terms of innovative thinking, a lot of papers use it as an assessment tool, either assessment of or as learning. But also second is teaching and instruction. So using AI or thinking about integrating AI into the curriculum, or AI competencies as our medical students evolve in parallel with AI tools evolving. And the other thing that to notice on here is that you can also use AI and think about how you automate case and procedure logs. So AI is becoming more prominent in our everyday working on the ward, and will become more prominent as time goes on. One of the things that was recommended was the facets framework, in order to think about how we evaluate different AI tools or applied AI tools within the medical education concept. And thinking about our study in context specifically, so what we've done is we've got the facets framework and we've broken it down here. So what we did was we used the Geeky Medics open access tool that was already available. We signed up to all the available chatbots that Geeky Medics had, which is differential case structures, and now they've got more than 400. And it's a form of AI that's ML and powered and adapted learning system that's developed by the Geeky Medics team. And what we did was we were definitely on the SARM model, we were definitely on the M or the R steps of the model. So it's a tool that's already existing, and we're now modifying it, repurposing its use for our educational focus. So I'm now going to hand over to Safa, and she's going to tell us what our students think.
Hi everyone. So just going through those same questions that we asked yourselves through the Slido link. So the first thing that we wanted to do was really ascertain what our students' experience of AI tools was previous to the session that we'd conducted for them. And if you just have a look at this pie chart over here, what it shows is that 80% of our students had some to little experience of AI, and only 20% of students had no experience at all of using AI. When diving in a little bit further as to what tools they had used, we really only had 3 students that had used chatbots before, and the majority of the students stated that they use softwares such as ChatGPT. And when we asked them further as to what they used ChatGPT for, it was for things such as writing and planning essays, summarizing research articles. Often students said that they use it instead of a search engine in order to answer their questions that they may have, and also for their personal use.
So now we're going to move on to theme 2, which is chatbot as an OSCE station. So chatbot as an OSCE station, so these are the 2 questions that we asked in our semi-structured interviews. So question 1 was about how the students felt about chatbot station in today's assessment, as an assessment today, and whether it was a good way of assessing clinical knowledge. We specifically wanted to ask about what year group they felt it was applicable to, why they felt this way, and what were the benefits and limitations. So the semi-structured interviews were about 10 minutes long, 10 to 15 minutes long. We didn't stop it prematurely if the students had lots to discuss. So it was a semi-guided interview. So when we felt like these questions were relevant to just guide the students to think a little bit more about this question. And we focused on theme 2 predominantly during the semi-structured interviews. In terms of question 2, we also asked about how they thought chatbot station could be improved, because this was directly after their mock OSCEs that we ran at Heartlands Hospital for all the third year students. And we also wanted to know whether, they had any benefits or improvements that they would like to put forward. So as a follow-up, so what we'd like to know is what your thoughts are as an audience on the use of chatbot as an OSCE station. I'm going to give a bit more time for this theme, just because this is the main purpose of our webinar today. I can see a few people typing. Need to define clearly whether it's for formative or summative purposes. Yes, and I think that's absolutely correct. So I think if chatbot is being used as an assessment tool, as teachers, as clinical educators, we need to work out whether we're using it just in the mock OSCE scenario, just in the classroom for teaching and clinical reasoning, or for summative purposes. Is it accurate? I think accuracy of the chatbot depends not just on who's building the chatbot, but also on perhaps who is the facilitator or the examiner. So we had a blended model where we had a facilitator who was human, who was asking the questions afterwards and actually deep diving into that history. So I'm just having a look through, so I'll start at the top. Good for students to practice as a supplement, but not as a replacement for having actors, okay. Concerned about how it may alter the focus of patient-centered practice. And that is what some of our students also put forward during the semi-structured interviews. Mock OSCE tool could potentially run their own stations. So we initially did try and do that, to run their own stations, but we ran quite a few mock OSCEs for 3rd, 4th and 5th years. And we felt that actually having a facilitator there or guide on the side was much more useful and intuitive. Do you lack actors? We'll go into that. So I think that we will deep dive into that a bit more. So I'd consider removing the examiner benefit of AI and chatbot as scalability. An examiner doesn't need to be present. At the moment, I think the way that chatbot is built, you do need an examiner just to facilitate the station, and with students being unfamiliar with chatbots in general. So I think a lot of students, I think 90% of our students were not familiar with this as a tool before we introduced it to them. Drawbacks is a conversation, lots of soft skills, loss of soft skills, yes, of communication, and not reflective of real life yet. I think we've covered most things on there, and we'll come back to this afterwards, but I can see that the themes that people are talking about are about communication skills, thinking about whether or not it's a formative or summative tool, and we can go over that in more detail. So now I'll just talk about what the literature says specifically about chatbot as an assessment tool or an OSCE station. Now, I think somebody mentioned it already, but it's where does chatbot fit? So we all get taught about assessment of learning, assessment as learning, and assessment for learning. And depending on the stakes of the exam, it may be that you use assessment as a learning tool, or for learning for chatbot? Or if it's off learning, are we going to, have that, 2 examiners within that station to make sure that the student has everything they need to interact with chatbot? So I think that where it lies within this framework, within what our educational concepts are today, is difficult to know. And as chatbot stations evolve or virtual patients evolve, I think we'll know where that falls. Assessment as learning. So Ko et al. Did a study in 2022, and Benny in the Chats was a chatbot that they built, and they looked at basically, different diagnoses, but specifically on breast lumps and surgical history taking. You can see that the chatbot was very repetitive. They kept saying things like, I have a right breast lump, I have a right breast lump, to different questions. So I think that it depends on who builds your chatbot. In terms of assessment for learning, formative or mosce are often used assessment tool for medical students. And we know that they have educational and preparative purpose, and we know they can be predictive in terms of, and have that value for students as well as educators to know where students stand and whether or not you need a one-to-one tuition for certain students. This has been long-standing, we know this. In terms of integrating innovative approaches and technology, we know that this is essential as we evolve in terms of medical education, as we have a lot more students to teach and less CTFs to teach them. We need to think about different approaches to educate our student cohorts. And this is not at med school, we're talking about our perspective in hospitals as CTFs. So I'm now going to hand over to Sid, to talk about what our students think.
Thank you. So what we saw is that, so we use this AI as like the chatbot as a like an assessment for a history taking tool at 2 places. The first was when they came for their introductory clinical course to us. So this was 63 students, and it was University of Birmingham and Aston medical students. We did a demo exercise with them. So they went through it, understood what the nuances of this AI chatbot history taking were. And then after that, we spoke to them, got their feedback to understand the various themes and what they learned from it and what they thought of it. So they did say that it was an interactive activity. It was really fun. It helped them, like it felt realistic, but maybe not as much as a real patient because communication was missing. A lot of them said that they would prefer it like as a supplement rather than a replacement, which was something that people highlighted even before in the Q&A. And there's that aspect of social interaction and familiarity of the structure of history taking that this would help build, which is something that we saw here. We analyzed these themes, did a qualitative analysis, and we're able to see how it covers both like cognitive aspect of learning and in the social theories of learning. Now, when it came to using the chatbot as like in a formative assessment or the mock OSCE tool, so 86% of the students, the most of it, if you can see the yellow, red, and the blue, they agreed that it is educationally useful to different extents. And a lot of them felt that it's like when you compare it to a traditional history taking station, like, like which is better, or so they felt that they're both useful, but you can't really compare because what exactly is being assessed is a little different. A smaller percentage, like 8%, felt that it's actually better than a traditional history taking station. So both in the form of an open text at the end of this form and from the focus groups, we explored these reasons more to understand what they were talking about. And whatever from what they told us, we have looked at it through the Van der Vleuten utility equation through that lens. So I'll just quickly cover those. So looking at the impact, so it's essentially a better tool if you're trying to assess the structure of a history taking and the diagnostic ability of a student, which for third-year students, when they're starting off in their history taking journey, is something that they felt was quite beneficial to them. So when we're talking about the validity of the study, so the content validity they felt was good because it was able to assess specifically what was going on in the history taking station, and it tested the content that they had learned before. Now, however, when you look at it on a whole for the construct validity, the art of interrogation, the rapport, body language, your tone, non-verbal cues, emotion, all those end up lacking in a station like this, and we're unable to assess it as such. So like, and also the other thing is that you can look back at what you did, like in a chatbot you can scroll and look back, whereas in real life and in a traditional history taking station you do not have that opportunity. Students still found it quite acceptable because they felt that if we could just use it specifically to assess that tool, then we can have a look at that. Okay, and it was quite reliable because no matter how the question was phrased in a certain aspect, we were still able to get like the similar answer back, consistent responses back to them. So that was like, again, so that helped this be quite reliable. I'm just going to hand over to Shah.
Yep. So we're now going to move on to our final theme, which is thinking about future uses of chatbot and AI in MedEd. And we asked our students these two questions. So do you believe there is a role for chatbot and AIs in the future of medical education? What do you feel the benefits and limitations are? So this was in the questionnaire as well as in the semi-structured interview. All of these questions were. How do you think chatbot could be further incorporated into the med school curriculum? And if not, why not? And what do you think the limitations are? And do you think these could be overcome at all? So I think those were the sort of questions we were asking. I don't know whether you want to make some notes or write them down, because we'd like to know your ideas or your thoughts about this as well before we move on to presenting our thoughts. Okay. So I'm just going to wait for people to respond to the poll. So how do you think chatbot and AI tools can be used in MedEd in the future? I can see a few people typing. I'll give you a few minutes to write down your thoughts. To support formative or practice assessment in the future, good implementation, say case-based MCQ generator. So the case-based MCQ generator, interesting that you say that, is something that medical students are already utilizing. So they're making MCQs based on a topic using ChatGPT. At least our cohort of medical students. We can't talk for every medical student in the country. And virtual patients producing teaching material, role in clinical med and MedEd needs development. Yes, we agree. Generic chatbots aren't always suitable for this, and responses are not reliable. And I think our students, we also agree with this point specifically. You need medical education specific AI models that not need to only be developed, but also need to be tested by students and tested by faculty as well, to ensure that they're giving the right education or actually meeting the right learning objectives on the curriculum. Scaffolded practice, yes, in terms of constructivism. Formative education, independently studied with clear guidance on shortcomings. And then I'm just going to read these 2 points. So as chatbot improves, they will be more objective than examiners in assessing students, currently using speech and virtual AI avatars for simulated patients and support clinical reasoning. Yep. So I think that there are 2 more people typing, so I'll just see what those responses are. But I can see that the main themes that I'm seeing here are MCQs, virtual patients, and checking knowledge. So a lot of revision as well as assessment in terms of MedEd. Okay. So what does the literature say? So in terms of the literature, so future applications of AI, so revision tools, especially in first and second year. So a lot of the literature says you can use it to generate your own notes, to summarize lectures that have been given in hospital or at medical school. Thinking about self-performance analytics, so your own race and competitive metrics. Patient simulators, which was mentioned by the audience. And medical education research, and thinking about, and we haven't talked about this in too much detail, but maybe using AI tools in order to help you conduct a systematic review, which I know is ongoing research at the moment, as well as machine learning for big data and precision medicine, etc. So actually thinking about the role of AI in patient care. Another thing that I think is really important to think about, and this paper is by Nike et al., is thinking about what about the ethico-legal lens for AI in medical education. So there's privacy, transparency, relevance, but also thinking about what's the governance and what's the legal ramifications of and considerations of AI. Is that doctor that we're testing using AI tools able to actually demonstrate all of the different sort of factors that we need to know as faculty that will make them a good F1, for example. So I'm going to move on and hand over to Dan for the final part.
Hello, so my name's Dan Langley, and I'm going to be discussing about a couple of the other questions that we asked students in both the surveys and in our semi-structured interviews. So the first kind of question was regarding like the future, what students felt about the future of AI in medical education was. So whilst almost 2/3 kind of like agreed that AI did have a role in the future of medical education, what's really interesting from when we actually spoke to students about this is trying to navigate what kind of role that actually is. Because I think it's one thing just to say that there is a role somewhere, but I think lots of asterisks came with that when students said it. So students generally agreed that it can be helpful for the early stages of learning skills like history taking, but they were generally quite reluctant about AI like past this point. They generally agreed that it can be helpful for the beginning of third year, just the starting placement, less so by the time we get to final year. In particular, students separately in different focus groups expressed skepticism regarding the use of AI by medical schools. For example, there was concern that due to reduced resources and things like that, institutions may try and use AI to substitute for clinical experience. I know lots of respondents in the survey today had some skepticism about AI and its inability to reproduce things like body language and other aspects of social communication. All the students really shared those concerns as well themselves. And then moving on to the specific point of chatbot as an assessment tool, do you believe that chatbot could be incorporated into medical school assessments? Again, only about 44% were either completely or mostly agree. There was a few more from then on, and everything from somewhat slightly wishy-washy, somewhat agree, up to disagreeing and not really being sure were most of the responses. And I think what's interesting there is I think many students clearly weren't convinced by this. And when we discussed this with them, I think the word "could" in our question was doing quite a lot of work here. So students were quite clear that they would need further support and experiments if it were to be used, certainly in summative assessment. For example, they specified they would need practice and support with setup leading up to the exam as well, rather than just just being put in front of a computer and asked to do an exam. There was also lots of concern that you lose something from the low fidelity here and the importance of human interaction and body language, while accepting it can be useful for some things surrounding clinical reasoning and things like that in the early parts, but AI is limited with the ability to combine that with the ability to show communication skills with the patient. So in summary, I think what we can take away from this stuff in the future is medical school expansion is coming. AI isn't coming; it's already here. And what med school expansion is going to do is going to put pressure on trust and education departments who are already having difficult discussions on resources and clinical opportunities for students. So it's not just as well as defining the role of AI in medical education, it's also equally important to define what it's not. So whilst we think there is potential uses of chatbots and AI for things like the precursors leading people up towards bedside teaching, hostel preparation courses before they start their clinical placement in the third year, some kind of formative assessments, and for them to self-study and use a revision tool at home, we have to be clear about what it's not and offer pushback if ever forces try to suggest that it could be used to replace clinical time, because I think all of our chats with students and other research we've looked at suggests that it shouldn't be used for that. So with that, we'd like to ask if anyone has any further questions, and we'll try to answer them as best we can.
Okay, thank you, Heartlands. I think we have a few questions from in the chat. One of them is from Charu Paltar. Do you have any students with additional learning needs? What was their opinion?
So do you have any students with additional learning needs, and what was their opinion? So we didn't actually identify students within our semi-structured interviews who had RAPs or additional learning needs. We do have students within our cohort that do have additional learning needs, and we do have students that we do a lot of one-to-one tuition with. I think just on a straw poll, so not in the official research, one of us has been working with one of these students with neurodiversity, who finds that the chatbot is a safe space for them to practice history taking before they go and practice the history taking framework on the ward. But that's basically not part of our research, but that's something that anecdotal that we've found that we've used.
But it's definitely something that we are interested in looking into in the future as well.
Yeah.
I think you've raised a really important question, a really important point, and I was thinking about that. I think this is, I mean, for me, this is just a personal opinion. This would be a great tool to actually learn the algorithms of history taking and fine tune those. But there's nothing like patient contact, because patients are unpredictable and their answers are unpredictable, and it never seems to go to textbook. So it would be a shame that if this is used as a way of, you know, if this decreases clinical contact time. But that's just a random comment.
Yes, and I think that it's really important to preserve the clinical contact time that our patients have with our students, and vice versa, because clinical reasoning at the bedside is super important in our training our future doctors, and we know that from experience. And I don't think. So hopefully our talk sort of told you how students and we as CTFs believe that it's a supplement rather than a replacement.
Yeah, absolutely. Yeah. We have another question from Jonathan Looms. How did you get through without ethics approval? Were there certain features of your project that reassured the ethics team?
Yeah, so we spoke to the UHB R&D theme, and our conversations were essentially because we were doing a quality improvement project as such, rather than true research, because essentially what we were doing was we were running the mock OSCEs anyway, and so we were just trying to make our mock OSCEs better, and we were using chatbot as one of the stations. So we weren't replacing the entire mock OSCE with lots of different chatbots, for example. I think this is a pilot. This is something that needs to be scaled up, and if we were going to use it at different hospital sites, for example, then we would have to get research ethics and further approvals. Yeah.
Does anyone else have any questions for the team?
Thanks.
Yeah, thank you. So that was brilliant, and I think I just wanted to add, I think what you described, that sense of comfort of asking a machine a question, as opposed to the sense of complete discomfort asking a patient a question, is part of the journey. And I think for me, that's certainly, you know, those are things that you had to overcome as a junior, you know, that sense of confidence. And it's interesting, and it was a very, very interesting presentation, and I thank you all for it. If there aren't any other questions, we'll draw it to a halt. We really look forward to hearing more from your team, hopefully seeing some more publications. So thank you again. Okay, just a few words from ASME before we round up, just to say thanks to everyone who's participated today, and a video of the session will be made available on the ASME website in a few days. And if you've enjoyed this bite-sized session, please do check our other events and Bitesize as well as Megabyte. And of course, we have the ASME conference coming up very soon in July. Okay, so thank you everyone. Goodbye.